ready.
Alrighty, sorry. Ambulance 1, respond code 3 to 1234, Elmo Court for an unconscious 30-year-old male. Time out 1400 hours. Any questions?
You said fire is en route?
I said code 3, but yes, they are.
Fire is en route. Okay, and am I going to a residence? Is this a care home? A place of business?
This is a private residence in a suburban neighborhood.
And I'm sorry, how old was the man?
30.
30-year-old male. Okay, let's head on in. And our belongings are inside.
That's correct.
Okay. So we arrived on scene. I'm just going to have you drop the airway bag and my monitor bag. So I arrive on scene. Am I greeted by anybody?
The front door is open for you.
Front door is open. Oh, yeah, ambulance. So I'm looking around. Are there any signs that I should be concerned about scene safety, like dogs, weapons, like a sign of like a forced entry?
Negative. It looks like a well-kept house. Wife is there.
Okay.
And patient is on the ground. Nobody else present. No dogs.
Okay, my name's Ashley. This is my partner Justine. We're with the ambulance. Can you tell me what's going on?
Yeah, this is my husband. He fell down. He's been pretty weak lately.
He fell.
Yeah, he slid out of his chair.
Okay, so I'm looking at the patient, and is he tracking me at all?
He is awake. His eyes are open, but he's not tracking you. He's kind of looking up, kind of dazed looking.
Looking up and dazed. Okay, what are his skin signs?
There's not a radial pulse. He is pale, cool, and diaphoretic. He seems like he has really tan skin.
Seems like he's got really tan skin. Okay, and so I'm also looking, I'm coming down to him. Sir, my name's Ashley. I'm with the ambulance. Can you tell me your name?
Told you should eat some.
You said that he should eat something.
He isn't eating like last week or so.
He hasn't been eating.
No, he's been all week.
I'm looking at his kind of quality of breathing. Am I seeing adequate chest rise?
Yeah, breathing is adequate.
Breathing is adequate. Okay, so you say he hasn't been eating for the past week.
No.
Has he been sick recently?
No, he hasn't really been sick.
So sir, he's gonna get a blood pressure on you.
Can you tell me what happened, sir? He's not responsive to my questions.
He's definitely very confused.
Definitely very
He's
confused
responsive to some questions.
to some questions. Okay, so I'm gonna kind of continue to get those vitals for me, the pulse, the blood pressure. Go ahead and get them on the monitor. I'm also assessing, is there any major bleeding, any signs of trauma? They said that he slid off of his chair.
No trauma. It was a very gentle landing.
Very gentle landing. Okay. Does he have any medical history?
No, just a little bit of hypertension, but he doesn't take any medications for it. He just got off of prednisone.
He just got off of prednisone?
Yeah.
Does he take any other medications?
I got 150 over 82. What is his blood pressure? I
He likes
got
to go on
150
hikes.
over 82.
Yep.
What's his
What was
actual
he
blood
taking
pressure?
them prednisone for?
70
Oh,
over 40.
He just got done on a hike, and he got he had a really bad poison oak.
He had some
His
bad
blood
poison.
pressure is 70 over 40.
His blood pressure is 70 over 40. Okay, what was his pulse?
Oh, he didn't have a radial pulse.
He did not have a radial pulse. Okay, so I'm feeling for the carotid currently.
You feel a weak and rapid pulse at 110.
Okay, 110. And then respiration rate,
20.
20. And his SpO2, please.
92%.
92%. Go ahead and throw him on a nasal cannula. I'm just going to take a look at his pupils really quick. Any notes on his pupils?
Pupils are normal, Carl.
All right, sir. I want you to squeeze my hands for me. Go ahead and try to squeeze my hands. And does he squeeze with equal strength? I know.
He's really confused at commands.
He's really confused at commands. Okay, so once we get him hooked up on the oxygen, I'm going to direct fire and my partner to help me get him on the gurney, and I want to start transporting. So while we're... Works. Okay, so I got him on that. So I'm going to let that run for a couple minutes and I'll assess any changes. So you said you have him on the monitor right now?
Yep, he's on the monitor.
Okay, looking at the 4-lead. What am I looking at?
You see sinus tact with some ST depression.
Okay. let's say we're in the ambulance now, and we're starting to transport.
Are you
Let's,
transporting?
we're gonna be transporting for the moment code 2.
You're a firefighter.
Fire rider. Let's take a rider. Let's take a rider today. I'm a new medic.
I'm not your firefighter.
I'm gonna start a line on him because his blood pressure is a little low for me. We don't have rolls anymore, do we?
You can just verbalize.
Okay. I have verbalized that I put a line in him. I'm gonna hook him up to a bag of normal saline. And he's running half open right now. Not there. I'm gonna continue with my secondary
What's your name?
assessment.
My name
Jesse.
Jesse. So after with the oxygen, am I noting any improvements with the oxygen administration?
His SpO2 bumps up to 99%, but otherwise he's unable. He's still ANO2.
He's still ANO2. Okay.
Well, I guess that answers that. So you're
I'm just gonna
you're
continue
ANO2.
with the secondary really quick, just feeling, am I noticing any, anything on his face, like any deformities or traumas or
Negative, all is normal.
no swelling? Okay.
Nope.
Looking at his neck, looking for JVD, any abnormalities?
Negative.
Can you take a deep breath for me, sir? Good.
All good.
Okay, gonna listen to his lung sounds really quick.
I'm gonna grab a BG on.
Yeah.
They're equal
I
bilaterally.
took a BG on him.
Okay, BG is 45.
BG is 45. Okay, so I'm gonna discontinue the normal saline for the moment, and I'm gonna get them attached to some D10.
I'm gonna give him some D50.
D50, no, I wanna do D10. So I've disconnected my normal saline, I'm gonna reconnect him to the D10. I'm gonna run that wide open and I'll assess in about 5 minutes. Reassess the BG. I'm gonna continue on with my assessment, and I'm sorry, my ears were in. What'd you say for the lung sound?
Clear and equal bilaterally.
Clear and equal bilaterally. Okay, just gonna be pressing into the stomach. Do I notice the patient reacting to any pain or tenderness?
It's soft and non-tender.
Soft and non-tender, just feeling the pelvis and then going down the legs. Do I note any traumas or any edema?
No, the only thing that you find is a healing rash on the lower
Regular
bilateral
right now?
legs.
Feeling
looks
rash.
like a minivan.
Yep, we're in the ambulance. We're getting you over to the hospital. Your husband said you kind of just slipped
That's
out
my
your...
wife.
This is wife.
You sounded
Yeah,
so
I'm
manly.
his wife.
And she's
Okay.
beautiful.
So
Or
I see
he could
that
be a
my
husband.
firefighter partner is asking questions and he is responding. Is that accurate to the patient's condition?
He's very slowly coming to.
Very slowly coming to. Okay, so because I saw some ST depression, go ahead and put him on a 12 lead for me while we're kind of waiting for that sugar to start. And then we'll get another set of vitals. So while my partner is doing that, I'm just going to get another set of vitals starting with the blood pressure.
New BP is 90 over 50.
90 over 50, going down, starting with the radial pulse.
Yeah, it's there. It's very weak. Still rapid.
Weak and rapid.
Still at 110.
110. Respiration rate,
One of them doesn't.
20 still.
20. And I'm sorry, rate and quality of those respirations.
They're slightly rapid, but otherwise adequate.
Adequate. Okay, and then SpO2 again.
It's still maintaining at 99 with the nasal cannula.
99 on the nasal cannula. Okay, what's our ETA to the hospital?
You're 10 minutes out.
About 10 minutes out. Okay.
I have him on the 12 lead.
Yeah, I'm
We
on
don't
the
have
12 lead.
that.
Oh, sorry. That's my fault. Here you go.
That's okay.
Oh, cool.
Okay.
Hey, Jess, do you have any chest pain at all? No? Okay. Anything like this ever happened to you before? You've been to the hospital recently?
Nope.
Alright.
It's regular.
You know what city we're in? Good job.
So he's a pretty healthy guy. He works out a lot. He's just off some prednisone. He's got a wide, weird QRS complex. Paramedic partner, are you thinking some kind of electrolyte imbalance? Yeah. Doesn't look good. Okay.
What kind of medications do you take? Nothing? Any allergies? Have you eaten today?
He hasn't been eating.
Hasn't been eating?
I'm just gonna pinch his skin looking at skin sugar really quick.
It's good. Yeah.
It's good. Okay. I do not like this.
Take a picture of it and send it to the doctor.
So if you're in Lake
Lifeline.
County, we don't do that.
Yeah.
You have
County has
to decipher.
See, I have Pulsar now, so.
We're not fancy like Humboldt.
And Humboldt's not that fancy.
It's just fly everybody.
You know what?
I honestly wouldn't know what to do with that.
Yeah. Let
just
me
looks not so
think. I'm gonna take a second and just reassess my patient currently. So going with this mental status.
Wanna go
Jesse,
country?
do you know where you are now?
I'm in a van.
You're in a van? Okay. Do you know what city we're in currently? Can you tell me the name of the city we're in?
Eureka.
Eureka? Okay. And can you tell me the month?
It's not February anymore.
It's not February anymore. How about the year? Let's go there.
21.
2021. All right, and are you kind of getting an idea, or can you tell me what happened? Do you remember why we're here?
Do you have a back view, Earl?
Been feeling
Back view, like
pretty lame lately.
Feeling
Yeah.
pretty lame lately?
Yeah, like tired and
Oh,
a little
he's fine.
nauseous. Not been eating.
Been nauseous and you haven't been eating.
Yeah, and lost a lot of weight. Like 20 pounds in the last week and a half. I'm
Okay.
not trying to do that. I'm trying to eat my wife's good cooking.
Well, I bet she's probably got some good cooking.
You have a job
And this is
outside at all where
appropriate
you
to
would
the
be
patient's response.
getting tan?
Yeah, I work forestry
Okay.
Okay.
under the trees all the time.
So again, can you remind me when you started feeling sick?
About
Incontinent at all?
a week
Incontinent
and
at all?
a half ago.
About a week and a half. And you feel like it's been getting progressively worse?
Got real worse today.
Yeah, it did. The blood sugar was pretty low, right? It was low, we had to give you some sugar. We're gonna continue to the hospital. Let me see where we're at currently. What's our ETA to the hospital, partner?
About 6 months, or
Oh.
6 minutes.
6 minutes.
months.
6 months. Hospitals still need to be invented.
It's a long transport, sir. Okay.
How's the transport? I don't know. Look at-
Also just reassessing his skin signs, all looking a little better. He's still-
Yeah, he's warming up. He's not as sweaty. Yeah.
Okay. Sir, I'm gonna check your BG one more time just because we gave you some sugar and some time has passed, so I just wanted to
Okay.
see where we're at. So,
Have you ever been told that you have Addison's disease?
My mom had it.
Okay.
your mom had Addison's disease? Okay.
New BG is the 85.
85. Okay. So we'll just keep that sugar running a little bit longer just because you were low.
Do you drink alcohol at all?
Not too often, no.
So your mom has Addison's disease, but you're not diagnosed with anything.
Nope,
No medical history.
nope.
Okay. And do you remember when your mom had Addison's disease, did she have similar symptoms like what you're presenting with recently?
I
Yes.
suppose, yeah.
Yeah. Okay. Well, we're getting you over to the hospital and we're gonna have you get you checked out. You know, this is kind of looking similar to that.
Okay.
Can't say for sure, but they're probably gonna run some tests on you.
I'll have to call my mom.
We'll get a blood draw for the hospital, even though they're probably gonna take it.
And I will do a radio report. So St. Joe's, City 1, Code 2, Level 2, Medical.
What was the unit you said you were? Sorry.
City one.
City one, St. Joe's. This is RN Zoe. Go ahead. Time is 13:42.
St. Joe's is City 1, paramedic Thompson. On board I have a 33-year-old male. Chief complaint, altered mental status, arrived on scene, and wife stated that patient hasn't been responsive. BG came back to 45. We administered 10. We administered 100 milliliters of 10% dextrose. BG increased back to 85. Patient is now more responsive. Patient has also stated for the past week and a half they've been progressively weak, losing weight, has a family history of Addison's disease. All vitals are within acceptable limits. We are ALS with an ETA of approximately 4 minutes. Unless you have any questions or orders.
Paramedic Thompson, did you get a blood pressure?
Yes, last blood pressure was 90/50. I'll cycle it one more time.
Did you continue fluids at all?
Yeah, I'm continuing the
You continued
D.
them? Okay,
Yeah.
it's now 110/60.
110/60.
Um,
Updated blood pressure 110/60.
Cool. Sounds good, Paramedic Thompson. We'll see you in a couple minutes. Room assignment on arrival. Cool. Anything you want to add before we wrap up?
Nope. Just going to continue to monitor and transport, paying particular attention to the patient's mental status and just the vitals.
Okay, great. You're at the hospital. Do you want to do a bedside report, or do you feel comfortable with your radio?
We could do a bedside report just for one of these for practice.
Go ahead.
All right, nurse. Sorry, what's your name?
Zoe.
Nurse Zoe. I have Jesse. Jesse is a 30-year-old male coming in today. Originally, he was altered at home, found by the wife. He had a BG of 45. We gave him 10% dextrose, 100 milliliters, and it came back up to 85. Patient has, now that he's alert and oriented more, he stated that for the past week and a half, he's been losing weight. He's got a family history of Addison's disease. And he said he is showing similar symptoms to what he noticed was his mom had. I'd like the doctor to take a look at this ECG that we did. 2 lead came back with some ST depression. This 12 lead is showing not so good things, and I think it would be beneficial for him to come
Abnormal.
check that out.
Okay.
He has no past medical history, not on any medications except he recently finished his prescription of prednisone for poison oak.
Okay. Thank you, paramedic. Sounds good. We'll take it over from here.
All right. These nice people are going to take care of you, Jesse.
Thanks.
Yeah.
So better.